Welcome to one more session of uh, welcome to one more session for ENT undergraduates. Here I am going to tell you in this session a case presentation of ENT case. How to take an ENT case. First time when you are coming to ENT postings, you don't know how to take a case. So this is the pattern how to take an ENT case. This starts with the chief complaints. As you all know, in second year postings, um, how you may know chief complaints, history of present illness, past illness, and all, but it is little different in ENT case. I want to tell you in detail from starting onwards. So first comes the chief complaints. Chief complaints should be in chronological order. Means first symptom comes first as per duration. For example, if the patient have three complaints, A, one is the ear discharge, and one will be the earache, and one will be the hard of hearing, for example, which is first according to duration, like this. So this comes to ear discharge for 6 months and earache for 4 months and hard of hearing for 2 weeks, like that. So according to the duration, more the duration will come first and lesser the duration will come last. So this finishes your chief complaints. Chief complaints should not exceed 3 or 4. You may have one chief complaint, but you should not exceed, try to see that you should not exceed the chief complaints for more than 3 or 4. So then comes to history of present illness. As per the above example, you have to elaborate the chief complaints in detail. This is called as history of present illness. So in the above chief complaints, you have three chief complaints here. For example, so ear discharge, you want to elaborate the ear discharge here in history of present illness. So ear discharge. Ear discharge you should elaborate in this way. This is one is the onset and next one is the duration, and then comes to odor and aggravating and relieving factors and quantity and any associated conditions. So like onset will be insidious or uh, mm, gradual in onset, and duration, this is for months, years, or like that. So months will come chronic, and days will come in acute. And odor, so the ear discharge, sometimes you may have chronic conditions and active diseases, you have foul smelling odor, and in safe type of CSOMs you should not have any odor. And aggravating and relieving factors, see, and sometimes diurnal variations also will come here. Aggravating and relieving factors will come, it may aggravate during the postural, during the sleeping time, and in the morning, or sometimes you may aggravate after bathing, like that. And relieving factors will be by taking any topical ear drops, the ear discharge may relieved. And any associated conditions, whether ear discharge is associated with any pain or itching sensation in the ear, like that. And the quantity will be copious, moderate, or continuous in nature. And this is for all the chief complaints. So this is continuous for all the chief complaints. You may elaborate earache also like this, and hard of hearing also like this only. And then ask the patient for any star. I marked star here. You see that after elaborating the chief complaints, you should ask for the positive complaints. Any other positive complaints? You have ear symptoms 8 to 10, and nose symptoms 8 to 10, and you have oral cavity and head and neck symptoms, chief complaints will be 8 to 10 minimum. So you should ask for the positive complaints or positive history first. So whether like that, whether the patient is having itching and any nasal complaints, any oral cavity complaints or fever or something, you any positive type of complaints you can ask, but you should write the positive complaints first. Why you should write the positive complaints first means the examiner may get irritation if you say all the negative complaints. So that's why, to gain the examiner's importance towards you, you can write the positive complaints first, and then you should write the negative history. No, like that. So like that, for example, no fever, no earache, no headache, and no nasal discharge, and no radiation exposure, like that. So this finishes in three ways. This finishes the history of present illness. First will be elaboration of the chief complaints, and then will be the positive history, and then will be the negative history, and then comes to past history. So past history, this will go in an order like this. See, you all know, even I know and you all know that positive history will be not what is new in this madam is telling like that. You should not think like this. See, in positive history, uh, in past history, what will happen, you all know, you should ask for the diabetes, hypertension, any surgeries like that. But this should come in an order like this. If you write in an order like this, examiner, you may gain attention of the examiner towards you. So this should be like this. And this is first any similar complaints in the past. So you should ask for the similar complaints in the past. What is called as, what do you mean by similar complaints? So similar complaints means, here in the chief complaints we asked, ear discharge and earache like that. So in similar complaints means any similar complaints means you have any ear discharge in the past, in earache in the past, or any. And why? Because I am talking about ear is, I took as an example as ear case. So you should ask for the similar complaints in the past that may correlate with the present history. And then comes to past medical history. See, then first you ask for the similar complaints and then the past medical history. As you all know, what should ask in medical history? Past medical history means that is chronically medication using diseases. So those are hypertension, diabetes, coronary artery diseases, and cardiovascular diseases, tuberculosis, and so any multisystemic disorders, epilepsy, convulsions, and you all know, etc. And then comes to past surgical history. See, here it is important, past surgical history. Past surgical history means you may think about that I can ask for tonsillectomy, I can ask for tympanoplasty like that. It should not be like that. You can ask for any past surgical history. It may generalized, it may related to any of the organ in the body. So any past surgeries which are even not related to ENT also. Why this is important means, you may gain a knowledge or an idea about the they may have any allergies to medication, and any general anesthesia complications, and any bleeding disorders by taking this past surgical history. And then comes to family history. As you all know, nothing new in this family history. Overcrowding and below poverty lines, and low socioeconomic status, and especially in India, in the family overcrowding, people may live in 8 to 10 people in one house and like that. So because of overcrowding, ear cases may be more. And so this is related to like infections and all. So family history will be any similar complaints in the family members. And then comes to menstrual history. This is optional. You may assess for the bleeding disorders here, and anemia status also in case of females only. So then comes to personal history. In the past, I told you, you all know what is special the madam is telling in the personal history. So no, not like that. You know what should ask in personal history, but how to ask, why to ask, and what to ask. See, there are 3 conditions here to ask: what to ask, and why to ask, and what should you gain in your mind after taking the personal history. So there are 5 to 6 things here to ask here. And first will be the diet, that the patient is taking mixed diet or non-vegetarian diet or the vegetarian diet. So this may have B12 diseases. If the strict vegetarian people will have B12 diseases, and the mixed people will have, this is go towards vaishyas and non-vaishyas, that may be for the general anesthesia also. And as you all know, so then comes to appetite will be adequate or normal. Whether there is a decreased appetite will go towards the carcinomas, and it may leads to weight loss also. So then comes to bowel. Bowel will be normal or disturbed. So this bowel will go towards the digestive system, and then will be the bladder. Bladder will be normal or disturbed. So it may go systemic disorders and all, you can rule out. And then comes to sleep. Here sleep is very very important. If the patient will have continuous ear discharge, nasal obstruction, any masses in the nose, throat pain, difficulty in swallowing, so there are so many ENT complaints. Those will cause sleep disturbances. If you have, see, not only the patients, if we have also the same, if even the human beings, we, you, me and all, everyone, if we have the complaints, you will be definitely disturbed your sleep. So that's why you should definitely ask for the sleep. How is the sleep? Sleep will be adequate. So if the sleep is adequate, means they are taking some medication, and that medication is relieving their symptoms. And if the sleep is disturbed, means due to non-relief of the symptoms due to medication. So this will give you an idea to take the patient for surgical intervention. So that's why the sleep is important. If the patient is not relieving their symptoms by medication, means you should take that patient for the surgical intervention, and that condition will be chronic. And next comes to addictions. Very 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 important. So there are here three addictions you should ask the patient, and how to take it is, here you can see alcohol, intake of alcohol, how many liters, milliliters, or half liter, quarter, or per day, and from how many years. See star here, how many years is very very important. How many years will make an idea about the patient symptoms, since the patient is having that symptoms for how many years. Patient is having how many years, and this alcohol intake will cause minimum of 10 to 15 years history. More than 20 years history will goes towards the carcinomas and malignancies, and little smaller the history, which will be irrelevant if they will take. An occasional things, shorter the duration, will not cause more effect on your case, but the chronic history, more than 10 to 15 years and 20 years, longer the duration, more liters per day, will give important here. So then comes to smoking. Smoking in the form of BD or cigarette, whatever may be, packets. How many packets? Some people used to drink, some people used to smoke only one cigarette, 2 cigarettes per day, and some people used to smoke packets per day. So like 1 packet, 2 packet, like this, and you ask for the how many cigarettes or packets per day and from how many years. The same thing will continue here, and so that goes towards the carcinoma history again. And then this is the chewing of the tobacco. How many packets per day and from how many years. See, we are here at the level of chewing of tobacco. So chewing of tobacco is in the form of so many forms here in the chewing of tobacco. What are those forms? You all know, in the form of pan, gutka, and some people, villagers, exclusively females, they will take tambaku or pogaku as a in small quantity. They will keep in buccal mucosa, left or right, as a habit. So this causes oral carcinomas. So that's why chewing of tobacco, how many packets per day or in what form, also important, and from how many years, also very very important. So next comes to general examination. So what is there, what is important in general examination. You can skip. Some people may think that I can skip general examination, I am taking an ENT case, why should I ask for the general examination? No, not like that. Very very important. Every step in the ENT case, not only ENT case, every step is very very important. So by this complete history you came one general idea about the patient complaints and what to take, what you want to go in the clinical examination, and how to proceed with that case. So now we will discuss here about the general examination. So general examination, as you all know, in second year there are 4 C's here. 4 C's. What do you mean by 4 C's? So one is conscious, coherent, cooperative and comfortably seating. Why this is important? Why the patient should be conscious, coherent, cooperative and comfortably seating? So I will explain you here where this is important, because you are not allowed or not allotted a case of non-cooperative patient in the exam, as they need immediate medical attention and treatment. So those are called acute cases, not allotted in the exam. So that's why conscious, coherent, cooperative and comfortably seating patients will be important here. So one thing will be, you star here, one thing will be so if the patient will be conscious, coherent, cooperative and comfortably sitting, they will give you a better history and the good history. So because if the patient will be with the symptoms and there will be irritating, non-conscious or non-coherent, non-cooperative patient, if they are not comfortable in sitting, and how come they will give you a history? So that's why we were not going to allot that type of cases, and those are not eligible for the examination. Those are in the form, if the patient is unconscious, non-coherent means one thing may be those patients need immediate medical attention, or they may not be relieved from the symptoms, and those are called as the acute cases. Only star here, only chronic cases are allotted for the examination, then proceed like this. So star, I told you many times, chronic cases are allotted for the examination. What is a chronic case here? So those chronic case means they are a little bit relieved from the symptoms. Those are called chronic cases. How they were relieved from the symptoms? Because of some medication and some small surgical interventions, sometimes like endoscopic evaluations and all, and with a small medical treatment, the patient will be relieved from the acute symptoms. Those are called as chronic cases. And in another way also you can call it as a chronic case, that is the history of more than 3 months duration. See here you can ask one question, if the history will be more than 3 months duration, how come we will write a 2 weeks duration in the chief complaints? So there may be at one time the complaints may be decreased, but again the recurrence of the complaints will be there here. So the patient may have recurrence of the complaints for many times. You take the recurrent complaints and you write the fresh complaints as a chief complaint there. So clinic general examination will go like this here. So one will be pallor means where to check. Pallor where to check, you know. You should see the lower palpebral conjunctiva. This indicates hemoglobin percentage and status of the anemia. So you want to proceed with the tonsil case, you need more than 10 grams of hemoglobin. So in bleeding disorders, you may not go for the tonsillectomy, any other surgical intervention or any other proceeding towards the surgical intervention of any case if the patient will be pallor. So that's why pallor is important. You can check for the pallor in the lower palpebral conjunctiva or in the tongue also, anterior 2/3 of the tongue. Ask the patient to protrude the tongue, you can see for the pallor. And one more place you can check for the pallor is the nails. Next is the icterus. Icterus, you know, again in the conjunctiva you can check. This indicates generalized systemic infection, liver disorders, like that. And madam, here we are taking an ENT case. Why the liver disorder is important? So altered blood parameters will not go or will not give a general anesthesia to proceed with the surgical intervention. So that's why every part of the examination is important. And clubbing, again this is going towards the medicine history, but we need a clubbing examination also important. You see, this is indicates altered renal function tests. So puffiness of the face and other symptoms, generalized anasarca and everything. Clubbing also important here for the systemic infections renal function test. Altered renal function is the same thing. So patient may be in acute conditions, poor prognosis, and you may not be, that patient may not be fit for the surgical intervention. And the facial symmetry, see star here, very important. Facial symmetry is, and I took an example of here ear case. Facial symmetry goes towards, it indicates the functioning of the facial nerve, seventh cranial nerve, which is very important in ENT. If the facial nerve will affect, you have a deviation of the mouth and drooping of the eyelid. So the two things will be important here, drooping of the eyelid and one will be drooping of the eyelid and other eye will be unable to closure of the eye, unable to closure the upper eyelid. You can check both like this. Unable, one will be one eye will be completely closed and one will be the patient is unable to close the upper eyelid completely, which is touches to the lower eyelid. So one unable to closure of the upper eyelid and then deviation of the mouth. Those two will go towards the facial nerve disorder here. So if the facial nerve will be affected in a traumatic conditions or any ear conditions like acute attic diseases or your atticoantral diseases, so called atticoantral diseases, where the facial nerve, if the facial nerve will be affected, patient will lose the facial symmetry. So that's why facial symmetry will be important. And then comes to cyanosis. Cyanosis in case of children and heart function, it indicates heart function. And the generalized lymphadenopathy. Generalized lymphadenopathy is important. You all know, madam, we are taking definitely when we will take a lymphadenopathy history in a case of tonsil, in oral cavity complaints. Why this is important? That is cervical lymphadenopathy. So this is generalized lymphadenopathy. What is generalized lymphadenopathy? Enlarged lymph nodes in more than 2 centimeters anywhere in the body is called as generalized lymphadenopathy. This indicates systemic infections and unknown primaries also. So this needs what investigations to write also. So sometimes you may this will go if the systemic functions it indicates systemic infections and unknown primaries. If you have matted lymph nodes everywhere in the body, not only cervical. See, important thing here is not only cervical lymph nodes. Generalized lymphadenopathy means enlarged lymph nodes anywhere in the body is generalized lymphadenopathy. So you can check for the axillary lymph nodes, inguinal nodes, and rest all you may have clavicular nodes, and like that you can examine all the generalized, all the lymph nodes. If they are enlarged, you may need to go for further more rarest investigations like PET scan also. So next comes to see that much importance is there for the general examination. So don't escape from the general examination here in ENT case taking. And then comes to vital data. Again we were talking about only small things. No, never will be the small things. So 8th one will be vital data. Why the vital data will be important? Pulse rate. As you all know, in the medicine you went for the clinical postings in second year. You know pulse rate, way to record the pulse rate in the radial artery, preferably in the right arm or left arm, left forearm. So pulse rate will be how many beats per minute. See here, the pulse rate will be correlated with the heart rate. You may know, you all know definitely. you finished second year. So how many beats per minute? So this may be 72, 80. For example, I am writing 72. It may be 80, 85, 102. So that may be irregular pulse rate. You have elevations and fast beatings. This is not relevant to ENT. You can skip that. You may learn in medicine postings. So pulse rate will be important. And then comes to heart rate. Heart rate will be how many beats per minute. You can examine with the stethoscope. So by seeing the lower left corner of the heart, preferably in the left ventricle, base of the left ventricle, you all know how many beats per minute. See, I told you sometimes it may correlate with the pulse rate, will be equal to heart rate. So most of the times it will be 72 per minute. It may be irregular. So there are so many murmurs will be there. We are recollecting the medicine here again. You may have murmurs. I am just recollecting that only because I forgot medicine so many years back. Okay, this finishes the heart rate. And then CVS examination. What is CVS examination? Cardiovascular system. What is cardiovascular system? Related to heart. So heart will be S1 is to we have. So I am also recollecting. You have systemic sounds here, S1 and S2 we call it as. So present or not, S1, S2 you can check with the stethoscope. And then comes to respiratory examination. So how you examine the respiration is the respiratory system. Respiratory system means lungs. So lungs, how many breaths per minute? So one inspiration and one expiration. Even though I forgot after finishing medicine, I am recollecting. So breathing, one inspiration and one expiration will come together, one breath. So how many it is? As per my knowledge, this is 16 to 20 breaths. So maybe I am correct. 15 to 16 to 20 breaths will be for the normal human being. Altered breath sounds may indicate here respiratory system problems. You may have ventilation, perfusion things and all. You have to go for something special investigations on this type of and the type of sounds. See, what is type of sounds? You can recollect. You are fresh, more than me. You are fresh from the second year. So, and type of sounds, adventitious sounds or normal breath sounds. So now you remember what is adventitious sounds. Something different from the normal sounds are adventitious sounds. So that is bronchial breath sounds, rhonchi and all. Now you may recollect it. So normal breathing or not, you can examine for the respiratory system by taking again with the base of the lungs, by asking the patient to take a deep breath and release in one inspiration and one expiration. So this finishes the respiratory examination, and then comes to CNS examination. Again I forgot what is CNS examination because we finished medicine so many years back, 20 years. So what is CNS examination? I am recollecting here. When we were undergraduates, we used to carry what is called as knee hammer. You all know knee hammer. So that is CNS examination. You may tap over the olecranon process and all. Okay, like that. So that is CNS examination. Rather than the plantar reflex and all, one great toe will go up. If you examine why the systemic function is important. See here in ENT, we are definitely not deviating from the ENT. CNS examination is important means, so you may have glomus tumors and acoustic neuromas in the middle cranial fossa. So many big swellings you have. So those may alter the four cranial nerve. Those may involve the lower four cranial nerves. So that function will be lost. If you have CNS, if you examine the CNS examination, by this much history only you came to know that that patient is having some systemic, some mass or swelling in the brain, like that. So that's why systemic CNS cranial nerve examination is important. And for you have 12 cranial nerves, for each and every cranial nerve you have one function, one or two functions, and how to examine you all know. So systemic CNS examination, you can confirm that the patient is normal or anything abnormal, and this finishes the routine examination of a case. In the next session we will proceed with the ENT proper examination or local examination of the ENT. Thank you.